Greetings, my fellow YouTube nurses. I want to say thank you again for everybody subscribing to the medically affiliated channel, and I want to just say that I'm going to answer a bunch of your guys' questions you guys have been asking me on Twitter. So let's just go off and start off with number one from good old Gregory Marcellin. Okay, you know what? Let me do this real quick. What I'm going to do from here on out is probably every month, the beginning of the month, I'm going to do like a Twitter questionnaire from you guys. So follow me on Twitter, don't forget, the description on the bottom. And then I'll just, if you guys want maybe the last couple of days at the end of the month, you guys just shoot questions, and what I'll do is I'll try to answer them, try to keep up on this, something new I want to do. And I'll do it maybe the beginning of every month, okay? So let's just start off with this. Okay, first one from Gregory Marcellin says, hey YouTube, you're my man. No, you're the man, dude. Anyway, it says, got any advice on how to dominate Med-Surg One? Yeah, definitely. I remember when I was in Med-Surg first semester, you go over the basics, the fundamentals of learning. So you're gonna go learn over how to, like, you know, do bed care. You're gonna learn how to do medical, like, information, how to break down pathophysiology, because you have to know this information. You're gonna have to learn how to explain it to the patient. Plus, you're also gonna do like medicine administration. You're gonna give like one medication. You're gonna learn the basics. Everyone's gotta learn fundamentals. So I remember doing that. You start learning the IV administration. You start doing the like sub-Q shots. It's just basic nursing. The vital signs, everything. So I remember first semester it got really difficult because I thought it was just going to be, you know, here and there, go to class, go out with my friends and hang out. It's not even like that. You start basically marrying to nursing. It becomes your wife or your husband, whoever's in the nursing game, and you have to put that first. Because I started struggling a little bit because I was going out with my friends, hanging out with significant other, doing your thing, but you start realizing your grade starts dropping. So to stay on top of your game, you definitely have to, you just have to know it. And you just can't pass the first semester and not, you can't forget it. You have to know what you learned to go to a second, you learn what you learned in second, and to move on and so forth. So the fundamentals of all the nursing for Med-Surg One, the way to conquer that is if you have an exam, let's just say you have a cardiopulmonary exam coming up in 2 weeks, right? You want to take a patient at the hospital setting who's got cardiomyopathy, who's got CHF, who's got PVCs, telemetry patient, anything to do with cardio. And then if you might also want to take a patient who's dual diagnosis with pulmonary edema, with pneumonia. And so you're taking care of lungs and heart. So you got cardiopulmonary for your exam, you know what to go for, because first semester you're learning how to break down the patho, you're going to do writing papers and a lot of care plans. So the way to conquer that is take care of patients at the hospital that you're going to have a test on for your exam. Yeah, alright, next question. Let's go. Hopefully that helps, Gregory. And thanks for following me on Twitter, bud. Anyway, Shauna Markham says, do you work 12-hour shifts every day all week as a nurse, or do you get some days off? Nope, I work 7 days a week, never get a day off. Just kidding. I always have different days, different work. When I worked at a skilled nursing facility, it was 4 12s, and then you had like, I think it was like 4 days off. It was nice. But at the hospital, it's completely different. As a new hired graduate nurse, as a new nurse there, they give you, for instance, it's 2 days on and then 3 days off, 1 day on. It's weird. So you really can't do anything the first 6 months as a new hire. So like my schedule will be Saturday, Sunday, then I have Monday, Tuesday, Wednesday off, then I'll be back Thursday. So it'll be sporadic, different times, different days. But check this out. I've learned that if you've been working there for 6 months or close to a year, you can work 6 12s in a row and then you have 8 days off. Basically, you work the last 3 days of your last pay period and then the beginning 3 days of your first pay period of the week, and then you get to have at least 8 days off. A lot of nurses do it. Sometimes when they take vacations, they'll go for a week and then they'll get their money back on that check because they still work the same amount of days. That's the beauty of nursing, guys. So yeah, it's different 12-hour shifts, and sometimes you just kind of have a schedule for the month, but it's different times of the week that I work. Alright, Shauna, thank you again for subscribing and following me on Twitter. Also, Craven Moorhead, man, that's a funny last name, but he says, I'm going to start a new job as a graduate next week. How should I prepare myself? Honestly, the best way to prepare yourself is just go direct, confident, and be yourself, because when I was in there, I got a little nervous, a little anxiety was, you know, going through the roof. I basically, what I always tell everybody is, you're going to just parachute, you're going to skydive and nosedive to the ground without a parachute. That's how you feel. you feel like you just do a crash landing. You got to go in there with your cojones and just man up, because honestly, when you start taking care of these patients, you have to know what you're going to do, right? So they're going to basically have you follow somebody for 6 to 8 weeks. They're not going to make you fly solo, I promise, because if you do that, that's going to be bad on them for not preparing you, and you can get, you know, them in trouble. So Craven Moorhead, your name cracks me up. Anyway, the best way to do this is to stay confident, and you're going to have a lot of training under your belt. You're going to follow someone for 6 to 8 weeks, like I said. And the cool thing about that, you'll be following different nurses, different tricks of the trade, and you're going to learn so much from all of them. So the best way to do that is to take notes, learn every day, don't be nervous. Yeah, just you gotta go and do it. I was nervous at first, but I went solo a couple days ago, which I'll do another video on that on my update on how I'm doing at the hospital. So anyway, don't be nervous, man. You got this. You're gonna get a lot of training before you go solo. Oh, another thing too, in the hospital, you have so many nurses there, so many clinical educators, clinical charge nurses there. You have any questions, they'll be there to help you. So that's the beauty about it. Alright, Craven, thanks again for following me and following me on Twitter and subscribing on YouTube. Anyway, next question from Charlene says, I have a question. In your first month of work, how you managed to remember everything you learned in the last 2 years of school? I didn't. No, just kidding. I actually forgot some of the stuff, but I remembered half of the stuff. The biggest concern is you're not going to remember every little bits and pieces of it. You're going to memorize and know at least, I want to say 75-80% of it, because how are you going to pass NCLEX? How are you going to know that stuff? So in order to pass NCLEX, you need to know at least 80% of what you learn in school. So all I would worry about, Charlene, is pass your NCLEX. Take maybe one of those educated, like what's it called, a review course. You know, they have a whole bunch, guys. I would definitely take one of those, because you can't become a nurse until you pass NCLEX. So check that out. Do the whole NCLEX review. It'll be worth it. And you're going to start remembering little things. I remember the best way I learned it from a nurse. She said, you know, people say if they're hungry they can eat a horse. Well, you can't eat nursing basically like a horse. It's like an elephant. You take bits and pieces, you learn every day. There's so many things you're learning. So it's a whole broad perspective. You're always going to be learning something. I'm still learning something. The nurses who've been there for 20 years are still learning things. So anyway, yeah, most important thing, pass NCLEX. Take a review course, you're going to be good to go. Hopefully that answers your question, Charlene. Thank you again for following me and subscribing. Alright, we got another one. MD Briner, bud. You ask, I have a question. Has a patient coded on you, or have you ever been involved in one, and what was it like? Okay, to answer that question, I haven't had a patient yet, thank God. It's going to happen to every nurse, but we did have a mock code. It was funny because we had the clinical educator come up on my floor and said, we're going to do a mock practice. We're going to borrow a room. Who's the nurse for that patient? And luckily they looked at me and said, oh, it's this guy. It's Nursemendoza or whatever. And I was like, dang. So I got a little nervous. It was my first 2 weeks on the floor. And then she gives me a report quick and fast on the patient. And it felt real. I go in there and all of a sudden the lady starts running down. They played it out perfect. She comes down the hall and says, you're my nurse for my husband, right? He's having a hard time breathing. He's agitated. He's anxious. I need you to come in there. I dropped everything. Went in the room. Dude, check this out. I went in the room, right? And there's like 3-4 people there with clipboards, and it's a mock. So they're watching what you're doing, and they're writing everything down to make sure you do it appropriately, and then they basically test you. So I'm a new nurse, right? So I went in there confident, just had to do what I had to do. Because in my nursing school, luckily we did a lot of mock codes, mock practices on dummies. So I went in there, it was a dummy, put the head of bed down, patient was not breathing, patient had no pulse. So what I do is I start doing compressions, start doing the rescue breathing. We call it code blue. We had a couple nurses, a doctor came in, crash cart came in, the whole 9 yards, guys. So I kind of had a practice mock test, didn't have a real one, but yeah, luckily I passed that. That was awesome. They emailed us, said that, you know, it was a good mock test, but it's scary. But as a nurse, you have to be confident and delegate and help your patients. So hopefully that answers your question, MD Reiner. You're all going to have at least one patient. Sadly to say, you're going to learn as they code. It's going to happen. Hopefully that answers your question, man. Next one, last but not least, we got one from Nursing Fail. That's a funny name. He says, websites to quiz yourself on for specific pathologies. P.S. I wish all nurses were as cool as you. No, man, I wish nurses were as cool as you, man. Appreciate you following me and subscribing. Anyway, he says that if there's any websites or quizzes that I know. There's a couple of them. And I'm going to put them on the link on the bottom right here. So first one I like to start off with is Fundamentals in Nursing, and I'll put the link on that, which one that's for. That's basically for your first, second semester nursing students who want to practice, learn what you need to learn to get ready for nursing school. That's the best thing, and I'll put that on there right now. Then there's a second link. I like this. It's flashcardexchange.com. I'll put that link right here. That's one of the nice ones because you can use it as a flashcard. It goes over everything: disease, injury, endocrine, cardiopulmonary, renal, vascular heart disease. Yeah, I'm reading it right now, so kind of bear with me. Ischemic heart disease, endocrinology, ADH, which is the antidiuretic hormone, syndrome, hypersecretion of all. I mean, it breaks down everything, guys, and it's like online, basically like note cards. It's cool. But my favorite one that I use to pass the NCLEX is called testpreview.com. I'll put that link on here also, and that helps for everything. You can go over microbiology, pathophysiology of all of the systems. You got diabetes, lymphatic system, the microbiology, NCLEX, and HESI exam preview tests. You can't go wrong with that. So that's what I got, guys. Hopefully that helps you guys. I can't believe this video is almost 11 minutes, but it's shorter than my last one. So I just want to say thank you guys, and for subscribing. Like I said, every beginning of the month, I'm going to have you guys drop me maybe some few Twitter questions, and I'll just do this beginning every month. We'll just do a whole new one every month, guys. Alright, y'all. Appreciate you guys following me, and don't forget, keep asking me questions. My fellow YouTube nurses, I'm out.